Hello and welcome to another episode of Daily News. Today's video is about common rabbit diseases. There are some common diseases and problems seen in rabbits that can be prevented by ensuring you have an understanding of what a healthy rabbit requires and the subtle signs that can tell you your rabbit is unwell. Rabbits are wonderful domesticated pets, but it should be remembered that they are very closely related to wild rabbits, and as such will hide signs of illness until they are very unwell, as this would make them easy prey in nature. We encourage close observations of your pet rabbit, a correct diet, up-to-date vaccinations and regular health checks to ensure you pick up the early signs of problems, and prevent diseases developing. The more common problems/diseases that we see in domesticated rabbits are overgrown teeth, snuffles, hairballs, uterine tumors, myxomatosis, calicivirus.
Overgrown teeth. A rabbit's teeth continually grow throughout its life, and if a rabbit is not constantly grinding their teeth down by eating fiber, we start to see their molar teeth forming sharp spikes that damage their cheeks and tongue. This causes pain that makes them reluctant or unable to eat. The incisors at the front of the mouth can, in severe cases, grow around in a curl, meaning rabbits cannot close their mouth or eat at all. Once a rabbit stops eating, their gut stops working and they can die. Prevention. 80 to 90% of your rabbit's diet needs to be fiber in the form of oaten or grass hay. The rest of the diet should be leafy greens, with pellets and other treats being minimal to non-existent.
Treatment. A general anesthetic and burring the teeth flat is the only treatment that can correct overgrown teeth. Snuffles, pastelosis.
Cause and clinical signs. Close contact with an infected rabbit can easily transfer the Pasteurella multocida bacterium to your rabbit. The bacteria can affect the eyes, discharge, redness, squinting, and forward/or nose, sneezing, discharge, thus giving the disease its name, snuffles. Pasteurella can infect other areas of the body as well, including ears, resulting in a head tilt, abscesses, seen as lumps on the body, and uterine infections.
Prevention. Some strains of the bacteria remain latent in the rabbit's nasal tract until the immune system is placed under stress, such as when a new diet or pet is introduced or if overcrowding occurs. Reducing stress for rabbits that are infected and the quarantine of new rabbits are good ways of preventing introduction of the disease or recurrence of signs.
Treatment. Treatment involves a long and sometimes repeated course of antibiotics. Occasionally surgery is required if an abscess forms.
Hairballs, trichobezoars. Cause and clinical signs. Hair can normally be found in a rabbit's stomach as they self-groom. However, as rabbits cannot vomit, hair must be able to pass through the gut. If it can't, then it will form an obstruction and serious complications. Hairballs are so common that they should always be considered as a problem in any rabbit that is lethargic and not eating.
Prevention. Hairballs are more likely to become a problem if there is an issue with the gastrointestinal tract, gut stasis, or they are not receiving enough fiber in their diet, so a high-fiber diet is a great preventative measure. Treatment. Sometimes surgery is the only treatment if the hairball causes a blockage in the gut. Medication to get the gut working again can also help. Uterine tumors. Cause and clinical signs. Entire female rabbits can develop a cancer called uterine adenocarcinoma, and it should be suspected anytime a new undesexed female rabbit becomes sick. Some of the more common clinical signs include blood-stained vaginal discharge, aggressive behavior, mammary gland cysts, and lethargy.
Prevention. Desexing early at 4 to 6 months of age. Treatment. Desexing, hopefully prior to the cancer spreading through the body. Myxomatosis. Cause and clinical signs. Myxomatosis is a virus that is transmitted by mosquitoes, fleas, or by close contact between an infected rabbit and a susceptible rabbit. The disease is recognized by swelling and discharge from the eyes, nose and anogenital region. Prevention. Unfortunately, there is no vaccination available in Australia. Invest in a mosquito-proof rabbit hutch or bring your rabbit inside at dawn and dusk when mosquito levels are higher. Flea control can help, and when introducing new rabbits, keep them isolated for at least 2 weeks. Treatment. The disease is invariably fatal.
Calicivirus. Cause and clinical signs. Calicivirus is spread by mosquito or through direct contact with an infected rabbit. This is a disease that damages the rabbit's internal organs such as the liver and gut, and can also cause hemorrhage or bleeding. The symptoms include going off food, being depressed and quiet, and you may notice some bleeding from the nose. The disease can progress very quickly and is often fatal.
Prevention. Luckily, there is a vaccination against calicivirus. It should be given annually to ensure your rabbit's immunity against it is maintained. Mosquito-proof housing as well as avoiding infected rabbits is also advised.
Treatment. There is no treatment available. Often there are subtle changes in your rabbit's behavior that may be a clue to a disease process occurring. If you have noticed any changes or are concerned about something your bunny has been doing, then it is advised to get them checked by your vet. The earlier problems are detected, the better your rabbit's chances are of living a healthy life.
Thanks a lot for watching. Please subscribe to our channel for daily videos.